wargaming, where they use a supercomputer and they input data and try to come up with possible scenarios for the future. And they were looking ahead in 1996 all the way to 2025. So on page 55 of that report, guess what they predicted would happen in the year 2009? It says influenza kills 30 million.
And this was written in 2005?
No, this was written in 1996.
Oh, okay. Okay, so they predicted that, that 30 million people here in the U.S. would be
yes
as a result of influenza. Now, okay, so they're talking.
What a lucky guess!
There was even some talk that even that Homeland Security. But the reason I'm bringing that up because that has encased in it some of those laws that is really a public health law, really, when you look at Homeland Security, and it deals with pandemic.
Yes.
And some people say that was written around the same time, 1996, 1997.
Yes. I've heard that when 9/11 occurred, which was 2001, of course, that the Homeland Security bill and the Patriot Act bill were already written. Okay. 1996 is around the time that Dr. Jeffrey Tobenberger of the U.S. Army Institute of Pathology took his team to northern Alaska, where they started digging up the bodies. You see, and then began the process to reverse engineer the 1918 killer virus. So, so all of these things sort of point to the fact that this is not natural. This is planned. This is something that's been in the works for a long time.
So, okay, so like earlier you said that we have that it is possible that 100 million people in the U.S. have already been affected.
Yes.
Now, is there like a time limitation from the point of infection to where they present symptoms, or are they just carriers? That's what I'm trying to understand. Is like when what triggers like a major outbreak.
Yes. Well, that's a good question. And what we're seeing is exactly what was witnessed in 1918 and 1919, that the so-called first wave took place in the late spring of 1918, and it seemed to be a very mild illness. Hardly anybody died at that time. But then mutations occurred during the summer of 1918, and when the second wave hit and the third wave hit after that, then a much more virulent form of the same virus caused all of the deaths. So it may be a good thing that so many people have already been exposed to the H1N1 with very mild or no symptoms, because maybe they have developed some degree of immunity. But now if the recombination or reassortment of genes takes place with the bird flu, then the immunity will be useless against a new virus that would emerge out of that recombination.
That's right. Yes. And it looks like it's headed there. I know some information that came out from Canada that talked about they had some patients that, and I think I have it here, but they were saying something as just what you were saying, the fatality rate is huge because it gets because it goes deep down in the lungs, so it's hard for the lungs to get oxygenated. But they were talking about the mortality from infection, or at least when they see the patients, is 7 days before they're dead.
Yes, and that there was an interesting report from a pathologist in Canada who, when he examined victims of what was called H1N1 or swine flu, when he examined the lung tissue, it didn't look like the disease caused by a swine flu.
Right.
It looked like the disease that's caused by a bird flu. The normal influenza virus causes symptoms in the upper respiratory tract. So in the nose and in the sinuses and in the upper part of the throat. Rarely does normal influenza go into the lungs. It can, but that's a rare occurrence. But this virus, whatever it is, that kills, it actually goes deep into the lungs, causes a massive immune response by the body, a so-called cytokine storm that fills the lungs up with fluid. And so a person basically suffocates on their own secretions. Other reports from the southern hemisphere paint a similar picture, that unlike normal flu, we see these severe respiratory distress syndromes, especially in young adults. 50% of the deaths have occurred in the age group from 5, in other words, young children, to 24. That's where 50% of the deaths have occurred.
This is in South America.
Yes, and there are raging epidemics in places like Australia, New Zealand, Argentina, Chile, and recently the president of Colombia in South America was said to have come down with the swine flu. So that age distribution, where mortality occurs in young people, that's completely different than what we expect with normal flu. With normal flu, the bulk of the deaths, maybe 90% of the deaths are going to occur in people who are over the age of 65. With this novel flu, the deaths occur in young people, and almost no deaths occur in people over the age of 65. So this is a completely different kind of a thing that hasn't been seen since 1918 and 19, when the primary victims, again, were young adults, young people in the prime of life. And in fact, their vigorous health seems to be what does them in, because they have such a robust response to the viral infection that this overwhelming immune reaction does them in through the so-called cytokine storm.
Right, I heard that this H1N1 works a little differently than the normal flu, because normally a fever would be indicative of that you're fighting and then you may be winning.
Yes.
But in this case, the raising of a fever actually ignites the H1N1.
Yes.
To cause, that's what I had heard. I didn't know if that was.
Well, there are different scenarios, and yes, you're right. In some cases, there is a fever, and that seems to cause, the infection to be worse. But probably in the majority of cases, there is no fever. In the majority of cases, there's no symptoms whatsoever. And so these are people who basically become spreaders of the virus because they feel well. They have no sign of any illness whatsoever, so they don't stay home from school. They don't stay home from the job. They're out in the public, and so they can spread the virus. Now, if we look at the so-called bird flu infection, we have similar characteristics. That the genetic makeup of this bird flu, which makes it so lethal, is that unlike normal flu that attacks the respiratory system in the body, the bird flu virus seems to have the unusual characteristic that it can attack any cell in the body. Any type of tissue. It doesn't have to be in the respiratory tree. In fact, in birds, it tends to be in the GI tract.
Brother Liam, if you don't mind, I wanted to go back to the report from the U.S. Air Force that you brought up that was written in 1997 that talked about this time that we're in right now. 30 million are projected to die or will die, according to the report. How are they able to put that kind of scheme into action to the extent where we're now confronting it?
Yes. Well, I think many people who may be viewing this saw a recent movie called Eagle Eye.
Right. Okay.
And that showed a situation where there was a supercomputer that was able to just basically control people and events according to a big program.